Meet Steve Gordon. Today, he will suffer from adult respiratory distress syndrome and will be treated at the Prairie A&M University College of Nursing in Houston.
Like they would do for a real patient, and then suction out any mucoid secretions. And it would come out of here and then go into the suction canister. They would also make sure to oxygenate the patient. The ventilator would be turned on, and we would oxygenate the patient by using 100% oxygen.
The simulation and Mr. Gordon are critical elements of the school's latest historical accomplishment, a PhD nursing program scheduled to launch in 2011. The pedagogical strategy, based largely on advanced simulation, already has been praised and funded. This recording, made by the School for Review Practices, shows students taking care of a patient just like Gordon, programmed with a severe medical condition.
And we put all this together, and that is the reason why we can applaud entities, philanthropic groups such as the Houston Endowment, that looked at our diversity, looked at our productivity, and how we were meeting the standards of society, and decided that they would invest in us by making a very nice contribution of $3 million toward our development of our PhD program in nursing.
Hi, Ruben Olage here with Dimensions. The college was founded in 1918, the university 1876. Today, Prairie View A&M College of Nursing, which provides hospitals all over the country with nursing professionals, embarks on a new PhD in nursing that will transform into what they call the new dominant force of the healthcare industry. How? Take a look. It will vastly increase the ability of PhD nurses to speed up the delivery of healthcare to patients, but also it will educate more nurses to serve in faculty roles.
Our population is growing in the world. The needs of people are very diverse. Also, folks are living longer. Life expectancy is now in the mid-80s to even higher. So as a result, we do have challenges of the need for nurses and other healthcare providers who can respond to those different human changes.
Changes in healthcare have been decisive. This book, A Hospital's Patient Register from 1926, serves faculty and students as a reminder not only of how educating nurses has transformed since the school started, but also of that which hasn't changed, the spirit of service and the training of sharp minds.
You're basically faced with like a patient. You know, they give you a scenario and it's your job to figure out, like critically think. There you go, that's the difference in nursing school. You have to use your critical thinking skills.
On the bigger picture, the PhD program will catapult the college to an even greater status within the Texas Medical Center. Richard Winerty is the CEO.
Prepares nurses as baccalaureate nurses with master's degrees, some with PhDs now, and it's a very important new development. And basically what you have at Prairie View is one of the great nursing schools in this country.
But greatness hasn't come easy. The school was the first to admit African American students west of the Mississippi 92 years ago.
We offer this educational experience to at least 8 or more cultures now and different ethnic groups, and to have a male enrollment of at least 12% that is also multicultural. And this shows that this university has been responsive to society's needs and has also kept in tune with the shift in demographics.
Every nurse's training here focuses on cutting-edge technology, but also on increasing their ability to respond to diverse scenarios. Ruby, a senior student who works in ER, told us about a patient suffering severe hemorrhage brought in during her shift.
We were taught, it might have not felt like it when you're in 4th semester and 3rd semester. Sometimes you may feel a little bit discouraged thinking you don't know it. But when you're actually put into the situation, it's like things come out of nowhere and you were like, oh, that actually, I did learn that, and I can put it into practice. So I feel confident now.
The future of the College of Nursing is in perfect sync with the needs of the city, the state, and the country. No doubt, the PhD program will fall into place with ease.
The doctoral program is going to center on human simulation technology pedagogy. And what we have to determine is whether or not when we teach students using human patient simulators, do we get the same or even better results?
Dean Adams is convinced that with the new health management agenda, nurses and nurse practitioners will lead medical teams as principal care administrators, and more. Nurses here are taught to see beyond the disease of a patient. They immerse into their social environment, their economic status, their family. It's no wonder some patients believe nurses are angels in their own right.
And it's because the nurse is the angel in that case, who is there looking at you, but also using all of the sensory perceptions and other types of tactile stimuli to let you know things will be okay.
For the Texas A&M University System, I'm Ruben Olagi.